Hello, welcome to my frequently asked questions. Today I'm looking at lip fillers, and did you know that one study found that almost 10% of patients who had lip filler were not happy with the results? So today we're looking at, well, why is that the case? What can I do to get the very best natural results? How can I avoid potential issues and risks? So in terms of lip filler, well, why is it that almost 10% of patients may regret having lip filler? Well, commonly it's the aesthetics. Overfilling of the lips with just too much volume reduces some of the contours and the natural appearance of the lips. Other reasons, well, swelling, bruising, unnatural appearance, lumpy bumpiness, feeling the actual filler within the lip. These are all other reasons where patients may feel that they haven't got quite the result that they're looking for. And we're going to look at why these things occur and how can we prevent things like bruising and how can we get the very best natural results. And then finally, well, very rarely you can have quite serious complications with lips, such as lip necrosis, and that's really caused by damage to the blood vessel inside the lip. And we can really avoid this using more modern techniques, and I will talk to you how you can do this. And then of course all of us have seen photographs or articles about celebrities who've had really unsatisfactory outcomes. Britt Eklund, where she's someone who said on record that fillers really have changed her appearance. Leslie Ash infamously had fillers and had multiple problems once the fillers were reduced, and has also and all these stories where fillers have been put around their lips can be avoided with modern techniques and using safer technology. So let's talk about lip fillers. So first of all, well, what are lip fillers? What constitutes beautiful lips? Am I a good candidate? What are the potential options for adding volume to the lips, and how is that done? I'll show you some examples, some cases of my own patients with before and after photos. Then we'll look at the recovery, we'll look at the potential risks and how to mitigate and avoid those issues, and we'll talk about the cost. And finally, I'll give you my tips on completing these treatments. So first of all, well, my name is Dr. June De Silva. I'm a facial cosmetic plastic surgeon in London, and I perform these treatments for my patients, surgical procedures on the face, non-surgical treatments on the face every day. And this video constitutes information, but it cannot constitute a medical consultation, and you really need to see a clinician in person to do that. So what is lip filler? Well, it's a non-surgical technique by which volume is added to specific areas of the lip, and it can be used to enhance, give definition, add volume, add balance between the upper and the lower lips, or balance between asymmetries in the right and left sides. And it can also be used to add volume where there's been natural aging of the lips, which often results in thinning of the lips. And lip fillers, well, over 95% of lip fillers that are used are made out of hyaluronic acid, and this is a complex carbohydrate that exists naturally in your skin and in joints. And so a clever pharmaceutical company worked out how to manufacture this, and now it can be used in their lips. And there are different types of HA fillers that have different properties, and there are some that are specifically made for the lip. And these tend to be water-loving, hydrophilic hyaluronic acid fillers that tend to absorb some water, which tends to give them a smoother, more volumetric effect, as opposed to hydrophobic fillers that tend to repel water. But for some patients, both these fillers are required in combination to give the best results, because hydrophobic fillers that add more definition can be used to create more definition along the lip line, add more structure to the lips. There are other types of fillers as well, including calcium-based fillers, polylactic acid fillers, but really these are best avoided around the lip area, as they will potentially lead to issues such as nodules and lumps and bumps, and really HA fillers are the gold standard for the lip area. So what are HA fillers? Well, they're a soft, gooey-like material, and you can see in this video, well, we can see that it's clear, they tend to retain water and absorb water into the body of the filler, and they have different constitutions. They can be softer, they can have more water-loving properties depending on the type of filler. What constitutes beautiful lips? Well, in a way, there's a number of characteristics deemed beautiful in terms of the anatomy. The philtral columns, well, this is where we have like definition in the lip. The vermilion border, which is really the border between the pink part of the lip and the skin. And we've got the oral commissures, which is the angle or the corner of the lips, and the tubercle and the body of the lip. And these areas can be defined by using different types of fillers in different areas. And also there's proportions in terms of the upper and the lower lip, and the golden ratio can be used to look at this proportion, and really the upper lip should be that little bit smaller in comparison to the lower lip for the most elegant lips. Now, of course, there's a lot of natural variation based on ethnicity and genetics, and so we're applying basic principles, but there's a lot of natural variation. Other lips are important. Well, this is a photograph of Amber Heard, and previously I did an analysis on some of the most beautiful models and celebrities all over the world. She came out with a very high score, and part of that was related to her lips and the proportions of the upper lip to the lower lip, the symmetry, the definition, and many of the qualities that we've been discussing. Am I a good candidate to have lip fillers? Well, the best candidates are going to have some of these characteristics: small lips, an imbalance between the upper and the lower lips, asymmetry, and then perhaps the most common reason to put filler in the lips is to beautify and enhance the lips, to add quality and femininity, or some patients it could be masculinity, depending on the natural volume required. But what are the various options? Well, we're talking about fillers, non-surgical ways of enhancing the lips. There are other options like surgery and fat transfer. This is not easy to complete because the fat is not as controllable as fillers. 50% of the fat may survive, but it's very difficult to do accurate volume enhancement with fat transfer because it's too variable in this area. Fat transfer works very well in some areas, like around the eyes and the cheeks, but from my experience, it doesn't work as well in the lip area. There are also lip implants, and this is made out of silicone, and silicone can be inserted into the lip, and this is a solid, not solid, but a flexible implant that sits in the body of the lip and adds permanent long-term volume. However, it can be felt, and it is not as adjustable as fillers, and so fillers have an advantage over lip implants in this regard. There are also permanent fillers, and I would highly recommend you avoiding permanent fillers in the lips, as I've unfortunately had to treat patients who've had complications from this, long-term cysts and nodules, and sometimes these permanent fillers, well, they don't stay how they're put in. They continue to absorb water over a period of years, which gives to unnatural looking swelling of the lips, and really permanent fillers in the lips are best avoided. Fat transfer can work well in some patients, and this is a patient who had some degree of facial aging, and so in combination with facelift surgery, I added some volume to multiple areas of her face, and that can work really well in softening features. Lip implants, well, for some patients, lip implants can work really well. And this patient had smaller lips, and by putting a lip implant, this is a flexible silicone implant, well, it really enhanced the lip and gave a natural constitution. And this can work really well for some patients. This is a patient with permanent filler. You can see the lips just don't look natural. They're almost like sausage shaped. And sometimes these patients can have really trouble period in trying to reduce the lips because they can cause cysts, enlarge, and cause an uneven appearance. And I treated this patient with surgery by reducing the size of the lips and taking out the permanent lip filler, but this is really quite a challenging procedure to do, but you can see you can get some excellent results while taking out the filler. So what are the advantages of lip filler? Well, it's quick, you have immediate results, minimal recovery, sometimes you can have a degree of swelling and a smaller chance of bruising. It causes some discomfort, and for some patients local anesthetic can be really helpful in making the lip numb and making it comfortable. And of course it's lower cost than having some of the surgical alternatives. And this is a video of me actually using local anesthetic in order to numb a patient's lips, and then using a cannula, which tends to cause less bruising and less swelling. Now, techniques can vary when it comes to lip depending on exactly what you need, but I tend to use a cannula because I find that's more comfortable for patients, it causes less discomfort, it's accurate, it tends to cause less bruising, and avoids the very serious issues such as necrosis of the lip. Because the cannula has a blunt end, it doesn't cause trauma to the underlying blood vessels. And I'll show you her results later. So, small lips. Well, this patient had like a smaller upper lip, so adding volume to the upper lip, we can see we've kept the balance between the larger lower lip, but it's just enhanced and given natural appearance. And it would be reasonable to add a little more filler, but it's important when a patient's having filler for the first time that you work with their comfort zone. And so I always show a patient what the result looks like during the procedure to give them an idea of how it's coming out, because you never want to add too much volume because a patient then can feel uncomfortable. And most fillers used in the lip will have qualities that tend to absorb a bit more water so they can fill a bit more after the treatment. This is another patient who just didn't like their upper lip, felt it was smaller, so by adding more volume to the upper lip, we've just created a more volumetric effect. This is another patient who had thinner lips. By adding more volume, both of it to the lip body and also definition on the vermilion border, it's just created a more feminine and a nicer aesthetic. There's also a degree of asymmetry. You can see a smaller lefter side compared to the righter side, and by adding more volume to one side, we can improve that asymmetry to some extent. And here we can see in a video clip, well, there's a naturally smaller upper lip relative to the lower lip, and by augmenting the upper lip, we've created a more balanced appearance and a more feminine, artistic view. Another patient with just smaller lips, and just by doing a modest amount of filler, just created just a more aesthetically pleasing result. So what are the risks? Well, as we talked about, the main one is just overfilling of the lips and an unnatural appearance. And there's no doubt that there is an aesthetic for this, and some patients like that quite filled and voluptuous look. My personal preference is a more conservative appearance, but there is a certain style to this, an artistic license, and some patients do like to have this much fuller look. But it does result in less definition in the lips, and it can draw people's attention to your lips and take away characteristics of the other parts of your face. In terms of swelling, bruising, unnatural lumpiness and feel, we can reduce these risks by taking precautions, and we can also dissolve the filler by using hyaluronic acid, hyaluronidase, which will dissolve the filler to water, and then we can re-inject this area with a more modest, more balanced approach to create a more natural result. And in terms of using techniques, well, using a cannula, well, that has a blunt end, it doesn't cause cutting of the needle, it slides in amongst the soft lip tissues, so it's less likely to cause bruising, it's less likely to cause swelling, and it will cause less chance of the serious issue of necrosis, where a needle is used and filler is injected into a blood vessel, which causes that side effect. Using a cannula will tend to be more safer. So what is the recovery? Well, some patients will get a degree of swelling, and about 5% of patients will have swelling for 4 or 5 days. And there's a small chance of bruising, and expectations are key, and some patients will need a top up at about 2 weeks. You can avoid the chance of bruising using techniques that I mentioned, but avoid things that thin the blood a week before the surgery. This includes herbal medicines such as fish oil, St. John's wort. It includes certain medications such as aspirin, ibuprofen. Use ice immediately after the filler, that reduces the chance of bruising. And there's some evidence avoiding exercise for 1 day can also reduce that chance. How about the result? Well, we want to use a hydrophilic, water-loving filler in the body of the lip, but we want to use a more hydrophobic filler to create more definition along the vermilion border. Generally, fillers in the lip will last for approximately a year, but more and more fillers are lasting longer, and so for some patients it can last longer than that. What about the cost? Well, the cost is going to vary depending on the person conducting the filler, whether they're a surgeon, an aesthetician, a nurse specialist, whether they're going to use local anesthetic to numb the area, the amount and type of filler that is used, the technique that is used. In the UK, we have something called the CQC, which provides an extra level of regulation and safety for patients, but many clinics are not registered with the CQC and are able to provide lower cost. So fillers are generally going to vary from anything from a few £100 to a few £1,000, depending on these criteria. So my tips are, well, when it comes to fillers, really you need to use hyaluronic acid fillers in the lips. Other fillers are best avoided, and really filler, I believe, is the current advantage over surgical techniques such as fat transfer and silicone implants. Really, fillers currently, I think, give the best natural results, and they can be so tailored to each individual. Cost versus the result, well, I would never recommend going for the cheapest option, because really there can be complications, there can be issues, and you're better off having a trained professional provide these treatments for you, as you can then get the best results, which are natural, and avoid risks. I believe that a cannula technique will give the smoothest result. It avoids lumpy bumpiness in the lip, and it will also tend to avoid the most serious issues such as necrosis of the lip. Less is more, in my opinion, and it's better to have a conservative improvement that looks natural than to have overfilling that looks too much. The surgical alternatives such as silicone implants and fat transfer, well, my belief is that currently fillers offer advantages because they can be so tailored to the individual. However, for some patients that have not had good results from lip filler, these remain viable alternatives. Well, today we've talked about what is lip filler, how can I get the most beautiful results, am I a good candidate, why are approximately 10% of patients not satisfied with the lip fillers. Well, we've looked at reasons why that is and how we can get the best results and avoid these issues. I do hope this information has been helpful for you. If you have any other thoughts or questions, please do not hesitate to contact me either via social media or by my website. Thank you for watching.